Escherichia coli, also known as E. coli, is a bacterium commonly found in the gut. Several types of E. coli exist as part of the normal flora of the human gut and have several beneficial functions. Most types of E. coli pose no harm, except for serotype O157H7. This can cause food poisoning in humans and can become life-threatening. A healthy adult will normally make a full recovery from E. coli O157H7 within 5 to 7 days. However, young children, elderly adults and patients with weak immune systems can develop a potentially fatal type of kidney failure called Hemolytic Uremic Syndrome. Symptoms of E. coli depend on the site of infection and which type of E. coli is causing the infection. Classic symptoms include severe abdominal pain, vomiting and diarrhoea that may be bloody. Abdominal pain is the first symptom and comes on suddenly. A few hours after the abdominal pain, the patient usually has watery diarrhoea. However, not every patient that becomes ill suffers from this. Other symptoms that may be present include fever, fatigue, and dehydration from loss of fluids and electrolytes caused by the diarrhoea. Symptoms usually become apparent between 1 and 7 days, typically between days 3 and 4, and can last up to 7 days if there are no complications. A large number of infected people have no obvious symptoms, however, they can unwittingly spread the infection to others. H.U.S may develop in 5 to 10% of people infected with a toxin-producing form of E. coli. This results in a severe kidney-related complication that could, in extreme cases, lead to renal failure. The specific treatment will depend on the type of infection. There are no current treatments that can cure E. coli O157H7. It just has to run its course. Cystitis infections usually go away by themselves after a few days. Sometimes a short course of antibiotics may be prescribed. Most doctors advise patients to drink plenty of water to avoid dehydration and get lots of rest. A sample of faeces should be sent off to confirm that it is an E. coli infection. Any contacts should be screened and the patient should be off work or school until the infection has cleared. With regards to the treatment of H.U.S, it depends on the severity of the infection. Treatments may include general support such as intravenous fluids, medications such as corticosteroids, plasma filtration of exchange, and dialysis. Again, antibiotics aren't usually used as they can increase the release of toxins whilst killing the bacteria, increasing the harm done to the patient's kidneys. How do you prevent E. coli? To help prevent the risks of E. coli outbreaks, keep good hand hygiene, particularly after using the toilet and before preparing food. Wash fruit and vegetables, particularly green leafy ones, to remove excess dirt, reducing bacteria. Cook meat well, especially ground meat. Drink pasteurised milk as it is safer than unpasteurised. Wash cutlery and crockery thoroughly in warm soapy water. Make sure you store food separately. Don't store raw meats next to other foods and use separate chopping boards. Some people have been infected by swallowing the water from swimming pools or playing in the lakes or ponds, so swallowing water during these activities should be avoided.